With us. First, I'm going to introduce Vicky Diamond. Vicky Diamond is our current Vice President and Chief Operating Officer of WellSpan York Hospital. And in the coming months, she's going to be transitioning to a new role within WellSpan as the Vice President of Ancillary Services and will lead our efforts in strategy and market development. She received her Master's in Public Administration from Wagner School of Public Service at New York University and is a Lean Certified Green Belt. She currently serves on several boards, including the Central Pennsylvania chapter of the American Red Cross and the United Way. Our second speaker will be Dr. Erik Kochert. He is the interim chair of the Emergency Department and Emergency Medicine at WellSpan York Hospital. He formerly served as the Hospital Director of Research in Emergency Medicine and has been a member of the WellSpan York Hospital medical staff since 2009. He received his medical degree from Sidney Kimmel Medical College and at Thomas Jefferson University and served as residency at Christiana Hospital in Newark, Delaware. He serves as chair of the Pennsylvania College of Emergency Medicine, Emergency Physicians Governmental Affairs Committee, and is an active member of the York County and Pennsylvania Medical Societies. Dr. Kochert has been the recipient of many well-regarded awards. Most recently, the past winner as the Pennsylvania Emergency Physician of the Year, awarded by the Pennsylvania College of Emergency Physicians. So a great honor in welcoming both of them. They have served an instrumental role in the rollouts of developing the improvements in the emergency department. And please join me in welcoming Vicky.
Good afternoon, everyone, and thank you for the invitation to come here today and to speak to you about our brand new, shiny new emergency department. And part of the reason we're so proud to come, not just because we built some new space and have new equipment, but we've really worked very hard over the last 5 to 10 years to develop an emergency department that supports the needs of this community. And you'll hear a lot about that from both myself and my colleague, Dr. Erik Kochert, today. So today we'll just walk through a couple of high-level things for you. First of all, who we are at WellSpan Health and how this impacts the community that we serve. We'll talk a little bit about the care that we provide for all the people within the community. And we'll also spend a little bit of time about why we configured and built the space and the services the way that we did. And explain to you what it means to have a higher level of advanced emergency care within this community, and then take some questions. But before we get to that, I actually have a question myself. So how many of you here, either yourself or a loved one, have used the emergency department at York Hospital? Okay. So I guess that illustrates the reason for the community need, as represented by so many of you in this room, and a lot of what we'll talk about today. So WellSpan Health, it is an integrated health system. It is a nonprofit, and we are very proud of the charitable work that we do. In addition to the 140 locations we serve, we also have locations in which we are serving patients. We actually have 6 acute care hospitals. Those locations are often private practices, physician private practices, imaging centers, lab centers, physical therapy. That's what makes up that integrated health system. Along with that, we have a regional behavioral health network. And that actually is something that is relatively new to WellSpan Health. We partnered with Phil Haven Health, which is one of the largest behavioral health networks in the country. And we did that only about a year and a half ago. And that actually figured in very prominently into the work we do within the emergency department. Partly because if you look at the national statistics, 1 in 5 people suffer with some form of depression and need some type of behavioral health. When you look at the emergency department, we actually serve 400 behavioral health patients a month. 50% of those will wind up with some additional acute care. So again, a lot of that went into that integration also factored into how we design our emergency department. And then we also have 15,000 employees that make up WellSpan Health. So those are all the people who provide care to you in our many communities. One of the other things we like to spend some time highlighting is the community impact that we provide to the organization, to the communities that we serve. And this is just one slide of a 36-page overview of what we provided within the 2016 year. And it's something we highlight, and I actually get a lot of joy in highlighting every week when we introduce new employees to WellSpan Health about all of the charity care that we provide, whether it's in free services for things that are not covered by insurance, like dental, like mental health, like prescriptions, whether it's helping victims of violence navigate through that, whether it's helping behavioral health patients. So services that aren't covered or paid for in any other way. And it's a pretty sizable benefit. If you are interested in learning more, this is my public service announcement. It is on our website, the 36-page community benefit report. So in terms of the emergency department project overview, as we thought about providing care for everyone, there were a number of populations or services that we recognized pretty early on needed to be built into the design of our new emergency department. And that included, as I mentioned, behavioral health, and you'll hear my colleagues speak a little bit more about that. The other areas we also recognize that are a big need in this community is what we refer to as our SAFE program. So, and those are, SAFE stands for Sexual Assault Forensic Exams. And what that means is victims of violence, often women, children, and even geriatrics. So victims who have special needs, and you'll see that we built that into our emergency department as well. The other areas we found a real community need are in areas of dental and in areas of orthopedic and ophthalmology. So a lot of those services are built into the emergency department. Often you'll hear about us refer to ourselves as a trauma center, a level 1 trauma center. One of the things that's really important to know about that is that we have to be set up in that designation, is that we are able to provide care 24 hours a day, 7 days a week, including having staffed operating rooms ready to go with physicians and surgeons ready to, at a moment's notice, to care for those patients. And the entry to that, to those types of services is through the emergency department. So a lot of our work and design was also built in. It was also, that was all an influence into how we built the department. An interesting number. So when we designed this building and started to really think about how big do we need to build this? What are the services we need to provide? You always do projections about potentially what are the numbers of people you're going to serve. And so this was the projection we started out with. So in 2013, our emergency department was about 50,000 square feet, of which we served a little over 77,000 patients that year. And so as we did the projections, we said we need to build this for 2025. So that was an interesting projection, and as projections often are, it wasn't completely correct. So if you were to insert between 2015 and 2020, and you were to go to 2017, we have actually already hit the 2025 number. So, so clearly a need for the community. What's particularly interesting in that number is that at the same time, one of the things many of us have been doing, many of us in healthcare providers have been doing within the community, has been to develop ready care, urgent care, other places, including walk-in hours for physician practices, those kinds of things, so that you wouldn't see as many people in the emergency department. So one of the interesting things about this is that during this time, we were actually removing a lot of the lower acuity types of patients from the emergency department. In fact, most of you have probably heard the term triage. Generally, triage basically means it's our intake process of when you come into the emergency department for us to understand how ill, how acute you may be in terms of needing care, and then we prioritize the resources to support you. There are 5 levels within triage. And so when you look at that, we go from level 1 to 5. 4 and 5 being the least amount of, illness or acuity a patient may have. Our numbers of levels 4 and 5, because of ready cares and urgent cares and additional hours for our private practice physicians going up, has significantly declined. So in reality, so what we actually see today is that 77% of the people who come into the emergency department are at a level 1, 2, or 3. So the more acutely ill. And again, very important thing for us to consider as we thought about, building this new facility. So one of the other things we find with an emergency department is that we do need to ensure that we continue to help build bridges for those people who do come into the emergency department. One of the things we are finding, and you probably can't pick up a newspaper or any type of media outlet and not hear about the opioid crisis or not hear about some of the violence in the community. And that requires a lot of resource. And in addition, it requires resources outside of the bricks and mortar of the emergency department. And from that, we find that we're often involved in helping people through additional charity care and support. And so in the past year, we've seen about $3 million in addition to specifically for people who have come through the emergency department that we've helped to support and other needs that they might have. The other thing, we wanted to give you a sense of the number of people we're serving within this community. So 59% come within the York County community. It's interesting because we are now starting to track the number of transfers that we get in from other hospitals and other counties, and that has significantly grown. And we also think that's because of some of the services and support that we have available within the new emergency department. We talk about treating people of all ages, and it looks like this doesn't have that, but one of the other interesting numbers, and I apologize, I don't know what happened to, we actually had the breakdown, but I can tell you 2 points about treating people of all ages. The growing number and age category is over 65. And when we look at this, and that's something you see nationally, but in the York County community, we're actually above the national average in the number of people over the age of 65. And again, that becomes very important as you think about what are the services we have to build within the emergency department to support patients growing in that particular age range. And it's very much focused then on things like, sorry to depress anyone, but cardiac services, oncology, things like that. And so again, a lot of our focus and attention is built around chest pain unit and things like that to support that growing population and the needs that are very particular to that growing population. The other increase we're seeing is pediatrics. And we're actually seeing quite a number of pediatric patients, not within the hospital itself because we're not a children's hospital, and there's very good ones within the Pennsylvania market, but specifically those pediatric patients who have an emergent issue that come into the emergency department. And because of that, we partnered almost a year ago with Johns Hopkins University, and we actually have our emergency department staffed with pediatric surgeons to help with that. And we just did an assessment of this year-long relationship, and what we found was 132 children had emergent surgery, which would have taken them out of the community. So a burst appendix, things like that, that we were able to treat here with really, really high quality, some of the best pediatric surgeons in the country. So again, we continue to look at those services and make sure we're meeting the needs of our community. So, one of the things we wanted to do when we built this new space was we really wanted to have people have a better experience. If you spent any time in our previous emergency department, it was very noisy. And in fact, what's often very surprising when you walk through the space, or at least I still find it surprising, is how quiet it is. And you'll find out that we have 70, 80 people in the emergency department, patients, and it feels quiet. And that's important to a healing environment. So that's one of the things you'll see and feel rather quickly when you come into this space. The space was also designed by using a lot of people who have performance improvement background. Lean is the methodology that we used. And we actually built what they called a cardboard city, where we designed the emergency department in one of our facilities, and people actually had, the physicians, the nurses, the people who would work in the space, the opportunity to actually envision the space and how it would be set up. And from that, made changes to where we might want a wall or where we might want something positioned to better allow us to provide very seamless care. And that was very well received, and it has served us very, very well. The other thing that we wanted to do was ensure more privacy. You know, previously we had kind of those curtains, and you kind of could hear, you know, those curtains don't blur the sound between patients. So we recognize that, and we actually now have bays that you have a lot more privacy and quiet from what's happening as we treat you. And that was very, very important to us. If you look at the first picture on there, it shows kind of workstations. One of the things I would want to just emphasize for you is one of the models that we put in place to provide better care was that's a space where we have our emergency room physicians, our nurses, but we also have our inpatient hospitalist teams. So those are the inpatient doctors that will care for you. And they are in the emergency department so that we have a much more seamless handoff if in the event you're going to be admitted upstairs. So we begin that care and coordination right there in the emergency department as well. Okay. So a couple of facts and figures. You know, we increased the size of the space. It was a $50 million project. We came in on budget and actually a little under budget, and we came in on schedule, and we're very proud of that. There was a lot of people working together and great engagement by our clinical staff. The other thing that we did because we built this new space is we are very fortunate in that we have individuals, physicians who are trained in disaster medicine and preparedness. And one of the things we did was we used that empty space and we practiced a number of pretty significant scenarios that might happen in a community, like active shooter and just different things like that. And we were able to really test that out in that new environment. And again, another thing we wanted to do just to make sure we were building the safest environment, and that went very well as well.
York County is a vibrant, thriving, evolving community. As York continues to grow, WellSpan York Hospital remains focused on caring for our friends and neighbors who call this community home. We knew there was a need to provide a more modern, efficient, and patient-focused emergency department at our hospital. That's why we came together, put shovel to ground, and built a new resource for the residents of York County and surrounding areas. WellSpan York Hospital is now home to a new state-of-the-art emergency department designed for streamlined treatment and exceptional service, serving as a regional destination for advanced emergency care.
Welcome to WellSpan York Hospital and the newly renovated emergency department. After 2.5 years of construction, we are proud to introduce it to the community. Thank you for taking a few minutes to walk through the environment with me so we can show you what we feel is a safer, more efficient, and more patient-centered care delivery system. With 82,000 people visiting our emergency department on an annual basis, it requires us to have a very efficient workflow. I'd like to take you through the emergency department and provide you some updates on the enhancements we've made to make sure that we reduce your waiting time on a daily basis. Welcome to the rapid treatment area. The majority of our patients who see us on an annual basis do not have severe injuries. Unfortunately, in our old environment, they waited the longest. In the new rapid area, they get treated very quickly as they're taken back immediately for care. We have our own separate imaging and laboratory areas to expedite the service, and they can leave on a much more expedited basis. Welcome to the main section of the emergency department known as the pods. This is where we take care of our more severely ill patients. What you'll notice is the privacy that we've provided through the design of the environment. Patients no longer are going through the main section of the emergency department to be seated. Rather, they have a private corridor and private entrances into rooms for their care. In addition to our adult rooms, we've designed spaces specifically for the children of our community. They were specifically designed to reduce the anxiety for both the child and their parents as we cared for them in a very specialized environment. Welcome to a special area of the new emergency department. For many years, the needs of our behavioral health patients were not able to be met through our normal emergency services. But now, working with WellSpan Philhaven, we've been able to design a space specifically for them. In this environment, we're able to provide better care in a soothing, calm, and quiet environment. So the SAFE team is a unique service that we provide here at WellSpan York Hospital. This is a team of nurses and clinicians that is specially trained in working with victims of sexual assault. We built a new helipad that's about a third larger than the old one was. The helicopters that come to us are actually much larger with many more people that are involved in it. Further, when the weather does get bad, particularly during the winter, and it does snow, it has an automatic ice melt system on it. What that means for the community is the sickest patients within the region can actually come to us with the assuredness that they will receive the highest level of care by the best clinicians in a great environment.
Dr. Erik Kochert.
And sorry that didn't work out, but don't worry, I was going to walk through a number of things that would have been shown in the video there. I think, you hear me a bit? Is that better? All right. I think, said most simply, the update of the emergency department just reflects the cutting-edge care that we've been providing for many years. We are, many of you probably don't know, we're home in the emergency department to a large emergency medicine residency. We do clinical research, including NIH-funded studies. We publish. Our faculty span the breadth of all the different subspecialties in emergency medicine, including toxicology, disaster medicine, and a number of other aspects of care, palliative care being another. So we really have known that we're a cutting-edge place to provide care. There's very few things that we can't do in the emergency department, and the old emergency department just really didn't reflect that. The facilities were outdated, and like I said, most simply stated that we now have state-of-the-art facilities that match the state-of-the-art care that we can provide in the emergency department. Some of the unique aspects of care in the emergency department include the Level 1 Trauma Center. We were just reaccredited. Had 0 findings, which is very unusual when it comes to accreditation of trauma centers. We also recently received a comprehensive stroke certification, so that's the highest level of stroke care that can be accredited. Simply stated again, really, if you're having a stroke, there's no better place to be than in the York Hospital Emergency Department. And we also are home to a accredited chest pain center, and there are a number of other things that we're the first to do, including the first ED to start doing warm handoffs in South Central Pennsylvania for victims of overdoses following naloxone reversal. So we're very proud of all of that. Some of the specialized aspects of care that we can provide in the emergency department actually are better able to do so now than before. Our behavioral health unit, which I will walk you through that since the video was not able to do so. Vicky mentioned our SAFE program, the Sexual Assault Forensic Exam Suite. We have a dedicated suite that's dedicated for just the examinations of these patients in the emergency department. We have a number of specialized rooms, including pediatrics rooms, orthopedics rooms, and much larger resuscitation rooms than what we had in our previous ED. Lastly, if you've ever driven on South George Street, I'm sure you have, you've seen the state-of-the-art helipad that's gone up, which is a pretty impressive structure in and of itself. So the behavioral health unit, as Vicky mentioned, we see about 400 patients with behavioral health emergencies each month, and that honestly doesn't even include patients who are suffering from substance abuse disorders and who overdose and are seen medically. We have this was a large need for us in that we needed a really dedicated space where we could house patients securely so that they didn't elope and that we could provide a safe environment with one-on-one observation for patients who are sometimes suicidal or contemplating harming themselves. And this unit is a 6-bed space. It's in a secure, locked environment. In addition to the 6 treatment beds, there are 2 quiet rooms and 2 interview rooms. And this is just an excellent space to help our staff, which includes 24/7 crisis counselors, to help provide care for patients anytime they need it. So the SAFE program is also a unique program. We're the only hospital in the region doing this, and this is a program that's run by Emily Huggins, who is a forensic nurse who actually was awarded a Nightingale Award, a state award for excellence in community nursing. And she heads up this team that takes care of patients who are victims of sexual abuse and physical abuse as well. It may surprise you to know that when it comes to managing these patients, a lot of this comes down to evidence collection in addition to medical care. And the average length of an examination is 6 hours. And some exams will last up to 8 hours. So we have a dedicated suite that allows for obviously privacy and security, but also a safe handling of evidence and collection. And then the SAFE team also then works with district attorneys to help proceed with investigations and ultimately prosecutions. A number of specialized rooms. I think that some of the ones that we're certainly most thankful for as physicians in the emergency department are the resuscitation rooms. As Vicky mentioned, we have a very high acuity, especially when you compare us to other community hospitals. And so we have resuscitations where we see our sickest patients, cardiac arrests, acute heart attacks, strokes, a number of things. And the physical space is actually now about almost 2 times as big as our previous resuscitation rooms were, which is much welcome when you consider all of the equipment that is oftentimes brought to the bedside, including point-of-care ultrasound or ventilators if we're intubating and putting patients on mechanical ventilation. Not to mention, sometimes for patients who are good candidates who are in cardiac arrest, we can do what's called ECMO, where we can bring essentially a perfusionist team to the emergency department to initiate almost the equivalent of heart-lung bypass in patients who are in cardiac arrest. These are things that we do in the emergency department at York Hospital, but are actually very rarely done in some of the local university-based programs. In addition to our resuscitation rooms, which are truly state-of-the-art, we have an orthopedics room, which is primarily where we do most of our reductions of joints or fractures. And in this room, we have the tools to do sedations right there in the emergency department. And we have what's called a C-arm, which we can do fluoroscopy or real-time x-ray to know that joints and bones are aligned appropriately after we've done the reduction. In addition, we have a dental room, as was mentioned earlier, and then rooms for dedicated pediatrics, just to help with a safe and friendly milieu for children and their parents and loved ones. The state-of-the-art helipad, as has been mentioned, this is really interesting, and also that there's a snow melt and an ice melt on this helipad. So it's, especially during certain times of the year, it actually looks like it's steaming. I'm sure you've seen it if you've ever driven by South Queen Street. But some of the other interesting aspects of this helipad is it's much larger, and there's really not an aircraft that it can't handle. Previously, if we ever were taking patients from Maryland State Police, their helicopters were much larger, and they couldn't land on a previous helipad. They would have to land remotely, and we'd have to rendezvous with and bring patients to or from the emergency department. And we've talked about the level 1 trauma center. So we're a level 1 trauma center. We're very busy. We see about, I don't know if it's up on the slide there, 2,100 patients a year. Of that, about 10%, this is a common question I'm asked, about 10% or 11% of those patients are penetrating trauma, so over 200 patients a year who we take care of who are suffering from penetrating trauma. And as I mentioned, we recently reaccredited with 0 findings and 0 citations. So, what did I say? Oh, what is penetrating trauma? Oh, okay. Penetrating trauma are, so it's, essentially if we break trauma down into blunt or penetrating, blunt are the falls, the motor vehicle collisions, motorcycle crashes. The penetrating trauma are the things that really find the news much more commonly, like shootings and stabbings, impalements, things like that. So with that, we can start to take some questions. And how much time? I know we have 10 minutes for questions. Yes?
2 questions. Thank you, by the way. $3 million in charitable care a year. What percentage is that of the total care? And the second question is, what is a warm handoff?
Sure. Well, I can take the warm handoff question.
And you're going to hand off the other one.
So when it comes to treatment of substance abuse disorder, specifically and helping to care for patients in the midst of the opioid epidemic, what we know is that what we've previously done in the emergency department is reverse the overdose with drugs like naloxone, which can stop the opioids from taking effect. And then we can monitor the patients to make sure that they are medically safe. Sometimes there's some respiratory issues that follow an overdose. But we didn't really have the resources to do what was ultimately going to be the most important next step, was to convert that save into meaningful recovery. There's a growing evidence base on ways that we can best do that. And we know that following an overdose, that is a teachable moment, an opportunity that we could potentially intervene and help turn someone's life around or get them into treatment. So a warm handoff it's a term that's being used in medicine, and you'll hear it being used across the state. There are lots of different places that are starting to try to standardize this. We were one of the first to do it. We work with the RAISE Project, which is a third-party organization that helps with recovering substance abusers. And they're essentially using funds allocated through the county, so we're partnering with them to do 24/7 evaluations or connect patients with substance abuse counselors following an overdose. So what we do is, once a patient comes in the emergency department and we've managed them medically and we think that they're able to go home, is we call for a warm handoff. And somebody comes to the emergency department to evaluate the patient and offer them treatment resources. So, the next question?
Yeah, no, that's a great program, and it's actually one of the programs that Erik has been recently recognized for. And it's very similar, we wouldn't let somebody who had a heart attack just leave the hospital and not have follow-up care. And yet, everywhere in this country, people have an overdose and they leave the emergency department, they don't have that follow-up care. So here's a program which then bridges that. And the numbers, over 100 patients already have been connected within the York community to this. And not everyone avails themselves to the services, but we're offering it to them to try to make a difference. So I was going to answer the other $3 million question. So in terms of, that was emergency department charity care. So that's just specific to one department within the WellSpan organization. For the Department of Emergency Medicine, our probable total budget is about a little less than $30 million. So I would about 10%. Other question?
You had mentioned that we had already hit in 2017 the numbers that were projected for 2025. Does that mean that you're already at capacity, your design capacity? And what does that mean for the future of the department? Do you need to expand again?
Yeah, that's a great question. So again, we built the department, again, trying to project what would be the numbers. And so are we at capacity?
Well,
No. So, some of the work that's underway right now has been to look at how can we more rapidly move patients through the emergency department. So I mentioned as one example having inpatient doctors in the emergency department so we can kind of pull those patients up sooner and get them cared for. Because one of the things when people are in the emergency department, you just don't want to spend as much time there as I'm sure many of you have had to spend. And so we're doing a lot of things around that. We do monitor how many patients come in an hour. We see about 14 patients an hour that come through the emergency department. So again, looking at that and looking at what are the resources. But there's many other projects underway, and I don't know, Eric, did you want to mention?
I can do that more. So, and again, when you speak to capacity, we're not at capacity. We have things that we can do, but it really involves a paradigm shift from the previous way of using beds in the emergency department. Our biggest point of constraint is our beds. And so what we do to make up for the volumes that have exceeded what we've projected is we've begun to use, and we, by the way, projected that we were going to do this with the opening of the ED, results waiting spaces. So we evaluate patients typically in a room, but what we try to do is if the patient doesn't need that bed any longer, is we try to get them into a space to wait for the results of their blood tests or x-rays, and even to start some therapeutic regimens like IV fluids. And we then try to use the beds and have available beds to take care of the next patient who comes in who very well may need it and be much, much sicker. So that is just one example of processes of care that we're nowhere near optimized. And it's really that struggling to optimize as the volumes have really reached levels far faster than we thought that they would that has led to some of the waits. I think Sandra is next.
So $50 million brought you an 8-year time horizon. Was future time expansion baked into that plan? And how soon before you're going to need to expand again? And at what cost?
Yeah. Well, I don't know the cost. Future expansion was part of the what we projected for, knowing the volumes would go up, and knowing also that our acuity would continue to go up as well. So as we planned, though, we knew from the very beginning that we were going to need to include in our planning new processes of care, not just in the emergency department, but in the system. Using the system in the most efficient way possible with the use of urgent cares and some of the retail clinics, as Vicky mentioned, and the streamlined hospital processes as well.
The other thing I was going to mention is it's also new models of care. So one of the things that we are actually doing in some of the other emergency departments within the WellSpan system is telepsychiatry. So looking at other things resources we can quickly pull and leverage and help people quicker. So it's a whole combination of things, but we still have a ways to go with this space. Again, we projected that this would be great until 2025. And we're finding that the good news is we're still at the same time looking at what are some of the other models of care and other resources we can put in place.
What if any, effect will the new, what Pinnacle is putting their hospital in, how do you think it will affect your program? Because obviously there'll be another major hospital here in York County.
So, that time will tell. I think it's a very good thing to have good quality health care, whoever's providing it for our community. We clearly need it. So I think that's a good thing to have another resource that people can avail themselves to. I do think in terms of some of the higher level care and emergent care that we can provide, that won't exist in the revisited Memorial Hospital in terms of having 24/7 operating room availability for traumas. They're not a trauma center. They're not a comprehensive stroke center. Those things take years of training, resource, specialized, skills and training and equipment to have. So some of those things will continue to be dealt with, at the center that can support it.
We have time for one last question.
Can you speak to any of the trends that, outside of maybe referrals of high-level acuity from other hospitals, any of the trends that maybe cause the higher than anticipated emergency room visits?
Well, I don't know because our volume hasn't really changed much. But as Vicky mentioned when she went through the demographics of our communities, we have an older population that we serve, and as whether we like it or not, the older the population, the more the morbidity and mortality. So we have a high acuity population, we have an older population, but we also are bringing in, or recognize as a regional referral center because of our capabilities. So we're taking more and more patients from other communities into York Hospital because we have capabilities to care for the most acutely ill patients.